Hello, my friends. I'm so happy that you're here. This is week 2 of the Child Life 101 series, in which we are talking about how to support kids in pain. So, first and foremost, before we even get anywhere, when it comes to kids in pain, actually adults in pain, anybody in pain, the best resource is Meg Foundation for Pain. So you can type into Google Meg Foundation for Pain. They are a nonprofit. They have the most incredible, well thought out, educated resources for people who are experiencing pain themselves, for healthcare professionals, and anyone in between. And I have had Jody Thomas, the founder, on our podcast. Sorry, I can't talk today. On our podcast for the past, I don't know, have we had her on once or twice? It should be more. And we've just been able to create this amazing resource about comfort positioning with the Meg Foundation. So that's all I'm going to say about that. You can just stop listening if you want, but maybe just listen a little bit longer, because I'm going to talk about how child life specialists support kids in pain, but they have incredible resources. And so as a child life specialist, I've seen the impact that pain can have on kids, and it's not just physical. It affects them emotionally, socially, and even cognitively in some cases. Research actually tells us that uncontrolled pain can lead to long-term effects like stress, anxiety, depression, as well as changes in brain function and even delayed recovery, which really matters and impacts the healthcare experience. So it can be incredibly difficult for parents to watch their child in pain, especially when kids have a hard time articulating it. And I think that's really where child life specialists and child life services get to come into the picture. We're trained professionals that specialize in helping children and families navigate that pain. And we play an essential role in not only assessing them, but helping them explain how they feel and convey it to the rest of the care team. So, how do child life specialists assess kids in pain? One of the key ways that child life assess pain is by observing their answers and their interactions with other care team members. So we pay attention to how the patient or parent reports it to the medical team during their exam about where it hurts and how severe it is and what type of pain it feels like, if it's sharp or dull or throbbing. And we consider that plus a few other factors. So we observe how the child is interacting with the care team, how they physically report the pain. We assess their age and developmental level and see if it's impacted by the pain. We look at and understand their previous experiences and how family support and what they've been through before may affect their pain level. So here's an example for you. While I was working in the emergency room, I saw so many kids come in with belly pain. And the causes, which we would learn eventually, were a myriad of issues, from gas, anxiety, appendicitis, ovarian cysts, more. It just covers the whatever you can think of. And as the care team of physicians and nurses worked on the medical assessment and treatment plan, my job was to assist the child in articulating their pain in a way that the team could understand even better. I also helped the child cope with the pain they were experiencing and made sure that their immediate family members were taken care of. Their needs for feeling safe and cared for were established. And so part of that was my role in building trust and rapport. And so those are just of the few things that I would do for a child that came in severe pain. I can't give you, too many specific examples because it constantly changes based on what's happening at the time, what the treatment plan is going to be, how the child's coping, how the parent is responding, their relationship together, and so many other parts. So now we'll move on to really understanding what the child's needs are. So once we kind of complete that initial assessment, it's time for us to determine what our interventions will be and how we can help that child cope with their pain or even alleviate some of the pain in some cases. And this can involve a variety of interventions, which are tailored usually to the child's developmental level. It can be as simple as playing games, counting, listening to music, or other distraction techniques. Whatever the child needs, we work closely with their family to understand what works for them outside of the hospital environment, and typically, try to mirror what happens at home with what happens in the hospital, if that works well. Then we kind of get into the advocating role. So we, as child life specialists, understand the little nuances of healthcare. And that's that this child needs labs drawn. So that means we could ask for some sort of numbing agent. Do we have the amount of time necessary to wait for numbing cream, which, can take as little as 30, as much as 60 minutes to work? Should we be looking at other options? Is this an infant? Can we give them sweeties? What are these interventions that we can do to help with the family? And then how do we advocate with them and on their behalf to the care team? So that looks like us walking over to the nurse's station, having a conversation with the nurse or the physician who's in charge, and talking about, being the voice of, okay, let's talk about pain for this upcoming medical treatment. Here are some ideas and suggestions based on their age, but ultimately the decision is up to you. And how can I help us execute this in the most efficient and safe way possible? So, while it can be overwhelming to think about all of the things, that's what child life specialists are really good at, is, being able to observe, have an intervention, and advocate all within the span of 3 minutes if need be. So child life is an essential role in helping kids with pain. So I hope that if you are a parent listening today, you're taking away a piece of the puzzle, which is you have to look at the whole picture. You have to look at what have their experiences been like before, what has worked before, giving kids choices and having them be, a confident advocate for themselves about what could help them get through the pain. I think another thing child life specialists do really, really well, and that parents can do well too, is believing the child, believing that they're in pain. Even if there's, we have judgment on our side, which may not align with what the child's physically showing. I see this all the time as myself, as a mom, when my kids are in pain and I'm like, oh, it's not that bad. But when you're in the healthcare situation, we have to use words that validate that pain, that are like, wow, I can tell you're in a lot of pain. I'm watching you do this or that. Or, in the opposite way, I have seen that you're acting like you're able to play a little bit more. I noticed that you're sitting up in this different way. Does that mean the pain has gone away? So validate, and you can do that a lot by just, observing and dictating what you see. So I hope that this little Child Life 101, how to help kids in pain, has helped you walk away with feeling a little more of an understanding about how child life specialists assess pain. My puppy, Winston, down here. Hey, Winston, come here. Thank you. How child life specialists assess pain, how they help kids in pain, some of the methods that we may use in terms of distraction or validating or counting or breathing to help them get through it. And overall looking at how the family system can then not only, use it right then and there, but perhaps take it with them through their future experiences when child life isn't available. Thank you so much for joining us for this Child Life 101, how to help kids in pain. And I realize that we just touched the tip of the iceberg, and there is so much more to learn from other professionals in the field of child life. This is my experience, my quick 2 cents, just to get this information out to you so that you feel more informed. And I'm so excited for next week when we talk about how to have difficult conversations with kids. And this can be anything from talking about the death of a family member or a pet, or transitioning out of school, or your brother or sister's in the hospital again, mom and dad are getting a divorce. And we will just talk a little bit about some of the basic concepts that are based in child life that we can bring to the table as parents and adults navigate difficult conversations with kids. Thank you so much for being here. We would love if you would review this podcast, write just a few words about what it means for you, and share it with a friend so that they can listen in. Thanks so much.